You know, you've heard about gum disease, or you probably have gum disease if you're watching this. So let's talk about gum disease. You know, if you think back a long time ago, gum disease was treated by Gingivectomy. In other words, it was assumed the disease was in the gums and you cut the gums away. Nothing really could be further from the truth there. This is a tooth disease. It's where the tooth joins the gum that's the problem, but it is the tooth itself and in the area where it joins the gum, where it joins the bone. That is the problem. Now, what happens is that bacteria will accumulate on the tooth surface and then will gradually migrate below the gum line, and as a result, the gum and the bone don't want to be anywhere near it. So the gum and the bone melt away. Primarily the bone melts away. That's how when your dentist goes in and measures a pocket, it's a measure of how much bone has melted away as a result of the bacteria in the root surface. So that's the first part. Second part is there's two different types of bacteria: soft bacteria and hard bacteria. Hard bacteria are little nodules or little barnacles that are stuck onto the root surface. Soft bacteria is the soft bacterial plaque that is in your mouth anyway, and as it goes below the gum line, some of that plaque develops into something that can be quite dangerous. Dangerous not just for your teeth, for your gums, but also for your heart, for your kidneys, for your liver, and for your other vital organs, brain and related diabetes and Alzheimer's when we're talking about brain. So there is a relationship between the bacteria and these diseases. So if we look at the soft bacteria, there's some soft bacteria that are okay, relatively okay, and there's some soft bacteria that are really, really, really aggressive and can cause tooth loss very quickly in some cases, and they can also cause these remote health problems that occur remotely from the tooth. We changed our approach to periodontal disease almost 20 years ago. You know, at one time we say, all right, we need to cut and make an incision in the gum line, peel the gum line back so that we can see the hard bacteria, those barnacles on the root surface, and clear it out. That was the approach we used to take, and frankly that was the traditional approach at that time. Now the approach has changed. Number one, because we know which bacteria, that there are some bacteria that are more aggressive than others, you know what the first thing I want to do? I want to run a culture. In this case, we find out the DNA of the bacteria that's there. You know, antibiotics can help, and I want to make sure that we're choosing the right antibiotics, so that if we send a sample of your saliva out to a lab and ask the lab to look at the DNA of the bacteria that's in your mouth, we can come much closer to targeting the bacteria correctly with perhaps an antibiotic that might help contain this periodontal disease. The second thing is the use of a perioscope. So imagine we used to make an incision into the gum line, peel the gum line back, so that we can see the root surface and get the root surface clean. And that had some effectiveness. It did. But now we have a camera that goes below the gum line, which helps us see even better than we could ever see when we made the incision. Why? I can't get to the back of the mouth and see directly onto the root surface, but you know what? I can take a camera under the gum line and I can see the back corner of a tooth below the gum line and see where that hard bacteria might be. And once we have that camera in place below the gum line, then our hygienists, Rebecca and Amanda, can clean it out. So one of the reasons for surgery is so we can see the bacteria. Well, we can see the bacteria better, or the hard bacteria better, with the scope, with the camera. The camera is also magnifying 40 times. My loupes, the loupes that I wear, only magnify 3 times. And they never help me get back into an area between the teeth, particularly in the back teeth. By identifying the bacteria and prescribing an appropriate antibiotic, and by getting onto the root surface and removing those barnacles, we've come close to 100% in treating periodontal disease without our ever taking a scalpel to the area, and also without taking a laser to the area. We don't need to use the laser, because as soon as the bacteria is removed from the tooth, the body heals. The body will replace some of that bone that's been lost. pockets will go away. Bad breath goes away. Bleeding goes away. And patients do a lot better. Now, there are other nuances here. Understand that it is not just bacteria. There's at least one other cause of periodontal disease that we know about, and maybe more. Another cause of periodontal disease besides bacteria are viruses. And viruses are different from bacteria. Antibiotics kill bacteria, antibiotics don't kill viruses. So on the rare occasion when a patient may not do well with antibacterial therapy, then there's antiviral therapy that we can use. Somebody gets cold sores, there are some creams and also some pills, capsules you can take in order to be able to take care of that virus. Same thing with a virus that might be in the mouth. So that's our second approach if the first approach doesn't work. There's a third approach. There are some people that feel that there may be other organisms, perhaps parasites, that may be involved with periodontal disease. Not a lot of literature on that, by the way, but there's some indication that may be true. That also responds to some creams, some gels, as well as some pills. And then there's the fourth thing. So we've got number 1, bacteria. Number 2, hard barnacles, hard bacteria on the root surface. Number 3, viruses. What's number 4? Number 4 may be that you just have a tendency to break down. But there is a tendency for the connective tissue fibers that hold the bone to the root to break down. There are some medications that we can use. Low-dose antibiotics, primarily doxycycline, that we can take in a low dose, not high enough to kill bacteria, but low enough to produce an effect that stops the tissue breakdown. It's called an anti-collagenase effect. Anti against, collagen is that connective tissue, ACE is the enzyme that breaks it down. So we may be able to reverse that, or at least stop that enzyme from working in order to be able to save your teeth. That means you're taking a very, very low dose of an antibiotic to stop this collagen breakdown from occurring. So those are the 4 approaches that we take, and we only take one approach at a time. The antibacterial approach and removing the callus works almost all the time. But then these other 2 approaches, the antiviral approach or the anti-parasite approach, or then if none of that works, I guess it was 5 approaches, not 4, wasn't it? Then we can work with the collagen matrix itself to try to stabilize the collagen matrix and stop the body from rejecting the tooth. Sounds a little more complex, doesn't it? Well, that's what's going through our heads when you're seeing our office, when you're seeing Dr. Furtado, when you're seeing myself, and when you're seeing Dr. Mansfield, my son. Those are the thoughts that are going through our heads as we're trying to help you save your teeth. Any questions, just let me know. Look forward to seeing you.